Today we will be learning about grids. Now objectives, why are grids used and what are the benefits of using grids? Now why are grids used? When an X-ray beam strikes a patient, many of the incident photons undergo Compton interaction and produce scattered photons. Typically, the number of scattered photons in the remnant beam that reaches the film is 2 to 4 times the number of primary photons that do not undergo absorption. The amount of scattered radiation increases with increasing subject thickness, field size, and kVp, that is the energy of X-ray beam. These scattered photons produce fog on the film and reduce the subject contrast. Because of this, we use a grid which is placed between patient and a film. When an X-ray beam strikes on the patient and scattered radiation falls on the grid, and later the scattered radiation is absorbed by the grid and the film is protected from fog formation. Now what is a grid? A grid or an anti-scattered grid is used to prevent the scattered radiation from reaching the film. It should be understood that the grid does not prevent the production of scattered photons but prevent them from reaching the film. Now functions. What are the functions of grid? The function of a grid is to reduce the amount of scattered radiation exiting a subject that reaches the film. The grid, which is placed between the subject and the film, preferentially moves the scattered radiation and spares primary photons. This reduces non-imaging exposure and increases subject contrast. Now, what is the composition of a grid? A grid is composed of alternating strips of a radio-opaque material, usually lead, and strips of radiolucent material, often plastic. Grids are manufactured with a varying number of line pairs of absorbers and radiolucent space per inch. Grids with 80 or more line pairs per inch do not show objectionable grid line on the image. The ratio of grid thickness to the width of radiolucent spacer is known as a grid ratio. Higher the grid ratio, the more effectively scattered radiation is removed from the X-ray beam. Grid with a ratio of 8 or 10 are preferred. Now these are the different sizes of a grids. We can see this in the image, and different types of grids are used with the different types of exposure of a patient. Types of grids. There are 5 types of grid which are used according to their exposure, that is linear grid, focus grid, pseudo focus grid, cross grid, and moving. Now firstly, what is linear grid? In the linear grid, the strips of lead are placed parallel to each other. While using the linear grid, cutoff of the beam can occur as some of the primary beam may get absorbed by the lead in the peripheral region. Sometimes this can also take place in the center of the film if grid is not perpendicular to the central axis of the beam. Now focus grid. In the focus grid, the lead strips are angled from the center to the edge so that the interspaces are directed at the focal spot. Now pseudo-focus grid. The center of the beam can be minimized by using a pseudo-focus grid in which the height of the lead strips are progressively reduced from the center to the periphery. Crossed grid. Another effective way of limiting the scattered radiation further is by using a crossed grid. Here, two grids are placed on top of each other and at right angles. This minimizes the scattered radiation transversing in the same line as the primary beam. Now, moving grid. The use of moving grid reduces the white lead lines in the radiographic image. This is achieved by moving the grid sideways during exposure. Now let's see what we have learned from this topic. When scattered radiation reaches the film, it sensitizes even areas which should not be sensitized. This produces radiographic fog on the film without optimum contrast that is required from optimum diagnostic quality of the radiograph. Film fog degrades the diagnostic quality of the radiograph. The X-ray grid acts as a filter, effectively removing scattered radiation before it reaches the film. Now, if we can summarize this topic, we can learn that grid is mostly used to improve the diagnostic quality of a radiograph. So, now what are the frequently asked questions in our university exams and in our college exams? That is, a short note that grids used in a dentistry.